The Oh My God packet has literally everything you ever needed to know. On the front page is everything that's included in this. At the very bottom of the page is very important. It should have this year's date. If it doesn't, you have an old one that got snuck in the little pile. So make sure you have that. Now, we revise these every year. One of the things that makes me different from most is I revise my shit every year or more often, depending on what's happening with the test. We know the test is changing in April. So we know the test is changing in April, so we know damn well this shit gonna change, right? What I tell the boot campers, as long as you say, Miss Shelley, I was at your boot camp, I need my revised, oh my God, you get it free. Okay, so everybody sitting here today that's coming from wherever you're coming, you're gonna get the revised. I'm in the middle of revising it as we speak, okay? I always go away on vacation, an island here, a country there, and revise different things. So I'm in the middle of typing up all the revisions I made while I was on vacation. So this will change a little bit to your betterment. Some of those changes I will tell you about anyway, right? So today, but I do want you to know that this changes every year. Now this is basically the study guide. The study guide for where do you start? How do you do this? You know, you go to school for however long you go, 1 year, 2 year, 3, 4, some even longer. We just had a young lady come up here last week. She actually had her master's. We posted her video. It's like, wow, you the bomb. So you go to school for however long you go, and then, you know, you have all these notes and shit, and you're like, what the fuck do I study? So this tells you exactly what's on that test. Because if you're like me, you would never know how to organize all them fucking class notes. You would never know how to start with all those PowerPoints. You would never know where to begin with those stupid expensive textbooks they made you buy. So in this packet, it's just giving you what you know. If it ain't something you gotta know, the shit ain't even in here, okay? Because we don't waste your time. I don't even give you ranges for labs. I give you one number because that's all the fuck you gotta remember, okay? So if we just dive into this real quick and give you some highlights of things you gotta know, we're gonna start on page 3, number 3 real quick. And behind me on this board, for the record, is the entire NG and Nclex test plan. In other words, beloved, when you took a final, you was given a study guide. But for whatever reason, y'all failed to look up, and it's on there for free. You know, Chat GPT got all kind of shit for free. But it's already been on there before anybody's AI. The whole test plan that you're going to be graded on. And so what I want you guys to imagine is this is your study guide. This is the study guide. So how you taking an Nclex and you don't even know the study guide, okay? So what we did was we put them on the board here with the different percentages of what they are. And then, of course, I've included it in this packet. So don't worry. You don't have to do anything. It's already in here, okay? Now, if you look at page 3, number 3, as you prepare to pass whatever test you're trying to pass, because so many people in this class tried to pass their HESI, they're trying to pass ATI, they're trying to pass the Nclex, they're trying to get out of finals, whatever. Whatever your reason is for being here. I do focus on the Nclex, but the human body doesn't change no matter what test you take. Remember, on this Nclex, as we prepare for it, because some people don't know this, there's a minimum of 85 questions, a maximum of 150. You could go anywhere in between 112, 92, whatever. But when I talk to students and they tell me that they fail, I ask them right away, well, how many questions did you have? Because it tells me how bad or good your test really went. I just had somebody yesterday, it was a first for me. I ain't never seen it, y'all. Yesterday, the baby said that she failed an 85, which what happens if you failed an 85? What does that really mean? Yeah, you killed everybody. I can't resuscitate them. They deader than a dog, honey. I can't do CPR. I can't defibrillate. Ain't nobody coming back to life. You killed everybody deader than dead, okay? So that's kind of like not a good plan. So she had already told me that. So I knew when she sent me her CPR, which when people send me their CPR report, it looks like this, as you know. And the CPR report is basically below, near, above, all that bullshit you get on the test. When she sent it to me, it said, oh, below. I said, oh, first, Boo Boo Kitty. You ain't know nothing on this test. She said, I swear to God, I was just like, I knew nothing. I really did. My school was in Florida. We know Florida has the worst schools. They didn't teach us anything. They took all our fucking money. I said, okay, well, yeah, that makes sense. So we have 85 to 150. Now, what if, because that happened the other day too. I had a little baby. It might even been in this class. I don't know. But anyway, they had 150 and they failed. What does that mean? They were this close to passing. They probably were a question or two short of passing. But now let's switch the game up. Let's switch the game up, baby. What if, hey, boo, how you doing, baby? Come on, honey. You know me. Okay, so what if they passed in 150? What do we say about that?
That means they got a lot right, and it keeps giving them a chance to keep going.
That means the last amount of questions that we did, and they
wasn't sure.
That means you barely passed. And what I tell people, when you pass in 150, I say keep studying. Because you don't really know shit. They barely let you in the gate, boo. Keep studying. Understand these numbers are not just here for just random test-taking numbers. No, boo, these numbers actually mean something. Okay, so if you barely pass, I need you to keep your U-World active. Keep studying, keep doing questions, keep looking at notes, keep my pink packets with you at work so you don't be up here at the job killing folk. Okay, because you barely passed. They barely let your ass in here. Okay. All right, so that is the deal. Now, if you fail in 150, you were really close. If you pass in 150, you was really close the other way too. So we want you to know what those numbers mean. How many do they throw out? They throw out 15, and those are your pilots. So this is what I tell you when you get ready to take the test, because many of you are going really quickly to take this test. This is what I tell you to do. You get this question from straight hell, and you read it, and you read it again like I taught you. You know it's straight from hell, because it ain't on nothing I gave you, and I give you everything on the test. And you're looking at it like you've never seen it before, and it is Greek and maybe a little German thrown in there for good measure. You know what you say to yourself? Oh, this is some bullshit right here. This question right here is a pilot. I ain't got to freak out over this little funky ass question. I'm going to do the best I can because maybe the answers look more familiar to me. So let me put more work in the answers because the question looks like it's straight from hell. So do not freak out. Just say to yourself, that is a question from straight hell. One of them 15 they're going to throw out anyway. I ain't finna worry about this question. Then also remind yourself, especially when you get to 85 and it didn't shut down, because 99% of my students shut the fuck off at 85 because you are a nurse and I teach you really well, so you're not going to be there all day anyway. So if it does not shut off at 85, please don't lose your mind. Please don't lose your religion. Please don't try to bomb the place and cuss everybody out. No, none of that. What we tell you is that if it does not shut off in 85, say to yourself, calm down first. You may take a deep breath, talk to God for a minute. Hey, what you doing? What, we had an agreement, what the fuck? You know, you might have to do that for a minute. But you're going to pull it together. And what you're going to say to yourself is, as long as they giving me questions, I'm a fucking nurse. Let me not lose it now. Because as long as they're giving me questions, I'm a nurse. I got to stay in the game. I can't cry. I can't lose my mind. Now, you might have to go pee, do some things, take a break, get it together, because you just knew you just was going to be gone in 85. But a lot of times, if you lose it at that point, you really did lose it, because it's all about the very last question you answered. It is so much about the very last question you answered. And you have to think, what was the last question I just had? Did I fuck that up? Because they sure in the hell didn't shut me down. They didn't shut you off. What did you just say on that last question? And start thinking, okay, slow down. Let me get it together. We had a little baby girl who was in here. She passed her test. I think she had 150, but she did them in 3 damn hours. So this is probably why you got 150. Because how long should 150 really take? How many questions an hour should you be doing? 30. Y'all got to pace yourself, which means you've got to analyze everything about the question. If you got 150 questions, your little ass should have been there 5 hours. The fact that you were there 3 meant that you were going kind of fast. and that maybe you would have been gone at 85 had you slowed it down. Okay, so it's okay. We don't give a damn. You pass. Who gives a shit? Nobody. Nobody gonna ask you in an interview, listen here, how many questions you get? How long did it take you? Nobody give a damn. So it's okay, beloved. But I am trying to get you up out of there in record timing for the test being correct. Record timing for you, 30 an hour or even slower if you choose, never faster. Because what you're doing is you're going with quality, not quantity. It's all about quality, which means right answers. And what do we say about select alls? What did we learn from our little guy in Texas who failed 18 times? What did he teach us, y'all, about select alls?
You don't know it, don't click it.
If you don't know it, don't click on it. Quit clicking, I think I heard Shelly say that. The fuck? Quit clicking, I think I read that somewhere. Quit clicking, that was on the ATI 15 years ago. No, stop it. If you don't know it for sure and could swear on the Bible you know it, don't click on that, y'all. Because what did we learn? We learned that if you click on it, they take the point away if it's wrong. And then it canceled out the one you clicked on that was abso-freaking-lutely right. Stop clicking on shit you not sure about. I laughed so hard. That guy that fell 18 times out of Texas, he told the whole class, all of y'all heard it. He told y'all, I figured it out, Miss Shelley. I figured it out. I watched your basic care and comfort video because every time I failed, I was wrong. In basic care and comfort, I get below. I said, oh, okay, baby. And then, oh, Miss Shelley, there's something else I need you to know. I figured it out. You tell your students don't click on anything they don't know for sure, because the test is going to take a point away for bad answers, and it's going to maybe give you a point for good, but you just canceled out your points. I said, oh shit. And when else is this important? Case studies. Think of a case study as select alls. That's all it is anyway. Think of a case study as a freaking 6-question select all. That's all you got to do. Because if you really look at a case study, that's all it is. It's got a bunch of damn options for you to look at. Don't click on that shit. I mean, even if you be like, I think this is it. Like, I really do. Like, but I don't know for sure. Don't click on it. We going for broke. We going for, I absolutely would swear to God on this. I absolutely would give my firstborn for this. I will sell my only house for this answer. I know it. It's the answer. I swear it. I seen it in the car right before I got out the car. I seen it in the oh my God packet. That's how people do it. Okay. Now, if you look at page 3, number 3, this is how you do your mastery. And if you're not doing it like this, you're not going to pass. I'm just going to be honest with you. This page is the most important page because it does tell you how to do my system. And as you can see, I got my little rules for you today. Your first rule was smile. The second rule is if you follow the damn rules, you will pass. Your third rule is grab your handout, student bathrooms downstairs, no eating, drink only water, $1 if you need it, lunch at 1. So here go rule number 3. Rule number 3 is that this is what you eat, sleep, and drink every damn day. You don't get to take a break. If you're in my class, you're going to pay a $5 fine for not doing number 3. And every day that you didn't do number 3, you got to pay me $5. Now, I'm thinking about going up to 10, but y'all already broke. Lord have mercy, they broke. It's a bad economy. I might need to start taking EBT. Okay, but suffice it to say that number 3 is the rule that you cannot break, babies. So when you leave me and I'm not charging you because you're from another state, you still got to do number 3. So let's read it. Number 3 is all about mastery. My entire curriculum runs on mastery. Mastery means, because some of y'all got the little thing where you don't even know what the fuck that means. Mastery means that you know each subject so well that there's no way on God's green earth that they can give you a question in it and you can't handle the business. In other words, You know cardio. You know GI. You know the hematology. You understand endocrine. You got renal wraps. You know neuro. You got your daggone hematology. You know all the geriatrics changes. You know every packet I ever made and every subject I made it on and every playlist that's attached to that packet. You already know it. We're going to prove it with number 3. Number 3 means you do quizzes. And notice I said mini quizzes. Mini is not a ton, that's many. Mini is tiny little quizzes. One of the things that my precious babies have done wrong when I talk to you on the phone is you were doing questions. You were serious about it. You had bought the little Bootcamp, which is a piece of shit. You bought the Archer, which is a piece of shit. But at least you were trying. You were trying to do the questions. You was trying to practice. You was doing your thing. Now, we only use UWorld here. You'll find out why later. But for you, you need to know that's all that works. I have the PhD. I studied all the fucking software. I bet you I know that. Okay, so when you're doing these miniature quizzes, what my students would tell me on the phone is they would say, well, I didn't do it like that because my teacher said I had to do 500 a week and I was doing like 85 at a time because the test can take you to 85 and I was doing 85 questions. I'm going to help you with this. If you're anything like normal, you know, like, and I assume that most of you are, there's probably some abnormal in the room, but I'm thinking that most of y'all are normal. If you're anything like normal, you are so over that shit. Somewhere around question number 30. You ain't even really doing this the right way. You clicking, but you're not really absorbing. And you sure as hell can't review 85 rationales when you're done. There's no way you're doing it. Stop your lying. I know you ain't. Who can sit there and review 85 rationales? And remember what I tell you, take notes on them. Nobody. That's too much for you. So I don't do that. I've never done that. I have you do tiny little quizzes. Tiny. Okay, so look what I wrote. And to be honest with you, it's more like 5 questions. It says 5 to 25. I've done 25. Reviewing the rationales on 25 questions takes me for fucking ever. I don't have that kind of time. I do the same thing I try to assign you guys to do. So I do 5 questions whenever I do anything with UWorld. And I will tell you this. It's so easy to absorb the 5. It's so easy to remember the 5. It's so easy to think about those 5 later. It's easy to look at the little rationales on the 5. It's even easy to find the white packet or pink and write the notes on the 5. It's kind of easy. So please just keep your little bites small. How do you eat an elephant? 1 bite at a time. This is a fucking elephant. You gotta pass. So little tiny quizzes. Now, 10 is okay. 5 is way better. Okay. Now, so it says all day, every day. Oh, okay. Wait a minute. Hold up. Is that all you did was 5? Because you're going to be in my class for 2 years. If that's all your little ass did in a fucking 24-hour period was 5 damn questions and you had a hard time with that, you're going to be in here forever. You're doing these all day long, precious one. You're doing these at work. You're doing these on lunch break. You're doing them in the hall while you're waiting on me to open the door. You're doing them in the car while you're waiting on class to start. You're doing them at the line at the Popeye's chicken because it's an hour line. You're doing it at the pediatric office because they ain't called baby or Shay Shay back yet. They running behind. You doing it at the bank line because everybody got their check on the 3rd. So now you done went in the bank on the 3rd, forgot it was the 3rd, and there you are in line. Get your phone out, do the picture, do the questions. This ain't gonna happen if you don't put the damn thing on your phone. I can't believe how many people I talk to don't even have the shit on the phone. Put the app on the phone. If you've had UWorld before on your phone, you will need to delete it and put it on there for your next subscription if you didn't just continuously keep it active. But put the damn thing on your phone because you know what? I know your phone with you all day. So if you used to doing your UWorld on a laptop, cut that shit out. Cut it out. Start doing some things on the phone. Laptop is fine if you at home. But I told you this shit's supposed to be all day. So take your phone with you, do this shit all day. So when you rise in the morning, yes, you got to pee, but you also got to take your phone with you because you got 5 questions. When you go to bed tonight, you got 5 questions. You tell your man, after 5 questions, man, you can do whatever you want. But for now, you need to take a back seat, bro. Calm the fuck down. Okay, so this is your priority. Your children will hate you. They will see your phone. They'll know what you're doing. They'll see those pink packets and they'll roll their fucking eyes. Or they will be your worst enemy because they'll say, did you do your homework, mommy? Because see, they sick of your ass taking the test 50 times too. Like, did you do their fucking homework? Because I'm tired, okay? This is your 8-year-old. They're tired, okay? They are the best cheerleaders on this situation. You know, if you stay with your dude, explain. It's going to be real rocky for a minute. And what did Essence say? She hadn't made dinner in 3 months or some shit. Okay, so peanut butter and jelly works. And peanut butter's a protein. Tell them. Use your dietary expertise, honey. Okay, mom and dad are going to take you out the wheel. Yeah, they're going to take you out the wheel because you tired of talking to mom every day at Fab like y'all used to do. No, you don't really have time for that, mommy. When I pass, I'll catch up with you. You're going to be fine. The church might be like, well, damn, she ain't as holy as she used to be. Because you stopped making chicken dinners for the damn church every Friday. Listen, this is your priority, period. Stop acting like Johnny's soccer team is more important than your damn questions. Now, my students have done those questions at the basketball game. I'm not mad at you. You cheer when you're supposed to, though. Pay attention a little bit, please. Your boy just hit a basket. You ain't even seen it. Damn. Okay, so you do need to participate in some of these kid things. But what I don't like is when you sign your children up for every activity and now you taxi mom and you got 3 kids and they each got 3 activities. When the fuck you think this gonna come into play? You tell Johnny and Bebe and Shay Shay, listen, this ain't your year. Pick one thing you want to do, and that's what we gonna do, okay? Because mommy can't be doing it like that no more. Okay, so these are things I see. These are just things I see that interfere with you passing. Now, you did it every day. You did it all day. You did it in what? What does it say on that first line? What did you do it in? What did you do it in? Same subject. Y'all mess this up all the time. I don't know where you get distracted from. I'll have you do a little bit of homework. And for whatever reason, whatever the homework was on the board, which is completely different usually than your mastery topic, whatever the homework is on the board, you'll go do a little bit of that homework and then you'll come back to your mastery and change the subject to whatever the homework was. I'm like, what is you doing? What is you doing? Y'all mastery topic was psych. How did you switch that motherfucker to maternity? I don't understand. They ain't even related in no kind of way. Okay, so don't do that, dear. Stay in the same subject. Now, until you what? Master that subject? What the hell does that mean? You just got your highlighter, so you should know. Turn to page 5 so I can show you. How in God's name will you know that you mastered this subject? On page 5, under number 2, if you look, there are lots of scores there. You are going to highlight the score that you need. And I don't know you from Adam and Eve's house cat yet, but you know you. So if you are, look at the first one, a first-time RN, you never took this test ever in your life. This is it. This is your first test. But the caveat to that one, because people mess this up all the time, the caveat to that one is you must have graduated in the last 30 days. If you did not, then your ass ain't new at all, okay? You are old, okay? You graduated too long ago. We're going to need to bump you up a little bit because half the shit you learned is played out, okay? So first time RN has got to be within 30 days of graduation. This is your first test. You've never tested before in your life on the Nclex. Then you need what score, everybody? 80%, right? Everybody see that? Most of you are a repeat test taker, either RN or LPN. If you're a repeat RN test taker, then you go ahead and highlight that 85%. Go all the way across from the RN to the 85. Go all the way across and highlight that bad boy, because that's you, boo. If you are an LPN that's retaking your test, then you're going to look at letter D. You're going to need the score of 75%. That's you, boo. Go ahead, highlight that bad boy all the way across. Now, if you are a new grad, but you are English second language, let's talk about what the hell is English second language, because it might be your 15th language, depending on what's going on. Oh yeah, make sure you get your hand out. Sorry, thank you, Darisha. So if you are If you are an English second language student, and let me write that how it's usually written on different documents. It looks like this, right? ESL. I specialized in my PhD in the English second language student, right? That's what I chose to specialize in, because when I was in Columbus, when I have a campus in Columbus, I have my Somalian students. I've had my Ghanaian students from Ghana. I've had my students from Nigeria. I've had my students, a million students from India. I have my students from everywhere, especially Latino students. You know, Haitian, Cuban, doesn't matter. Whatever it is, it's English second language. Now, it's a bit of a misnomer or a mislabel, if you will, because it's only in America, sadly, we're so fucked up on this issue, but it's only in America that one language is ever spoken. In other words, what I mean by that is Americans wake up to English, they're born with it in their ear, they're newborn, that's all they hear. And sadly, you get introduced to another language somewhere in 7th grade when you fucking don't learn it as well as if you could have learned it at 3, which is an optimal time to learn languages. So what happens is all Americans are just doing the one language, but everybody else in the world is speaking 2, 3, 4, 5 languages. Now, so English second language is a joke because really you may speak a ton of languages. So it's not to say you don't speak more than one or that, you know, English is second, third, or fourth. Here's what it does mean. When I specialize in this English second language student, what I learned is that they are concrete translators. Concrete translators means if you said, hold your ponytail, and in English that means hold on a minute, shit, chill. Okay, you tell your kids, you know, you tell your 5-year-old, hold your ponytail. She's gonna do just like this. Because she's what? A concrete thinker. She's not abstract enough to know that you mean, wait a minute. Okay, the English second language is a concrete translator, so whatever it says, that's what it is. Okay, unfortunately for that student is, you may have read it as this, the test will change it up and say it's that. I get you to challenge yourselves even when you're choosing your questions on UWorld. I deliberately will say, I want you to do ortho. And then I'll see who comes back and says, I can't find ortho. That's because you're not critically thinking what other terms may have been used. In other words, ortho or orthopedics is the same as musculoskeletal. If I tell you to do cancer and you freak out because you don't see cancer and you go, I can't find cancer, then I know you're not critically thinking oncology. If you take this UWorld and you're looking for questions on the other one that you do so badly, what is it? It's you're looking for, let's see, you got the ortho, you got the, oh yes. So I say psych, right? It's the first mastery topic. It's the first one. And I can't find psych. Okay, well, mental health is psych. That's what I mean. And it's not my it's not my ESL students that do that, okay? It's the English American student that do the shit I just told you. But my point to you when I brought those 3 examples up is that this is the struggle of the English second language student. Not only that, it's a culture issue. And one of my students, I was doing a consultation on the phone. I had reviewed her, what do you call this CPR report, and she did really poorly, I think, in health promotion and maintenance and psych. And I see that a lot. In fact, again, having this PhD specializing in this group of students, I know for a fact that they fail psych the most. That's just what I see. And health promotion next. So I was talking to her, she got offended because, you know, I'm kind of ghetto, fabulous project chick, but she got offended because I said, well, baby, one of your risk factors is that you are English second language. I speak 16 languages. Listen, let me help you with this. It's not what you speak. It ain't even what you read. It ain't even what you heard. It's the culture as well. So what do you mean? I said, okay, well, let's do a question. Okay, let's just go on and demonstrate because I can show you better than I can tell you. I said, what is the baby's first toy? What is the newborn's first toy? She gave me the rattle. She gave me the teething ring. She gave me all kind of shit. What she didn't give me was the answer, and the answer for this is this, and she had never heard of it, proving my point that culture matters, okay? So in other words, beloved, a mobile, and automobile is not the first, I didn't say automobile. I said a mobile. I don't even know what that is. I know, that is my point. In your country, you probably don't even have anything like it, okay? So don't sweat it, all right? Just know that my expertise in this says if you have been in this country less than 10 years, you have an 88% failure rate. That's pretty fucking high, okay? Now, if you have been in the country longer than 10 years, well, then your passage rate is 49%. Now, the American students' passage rate is falling with this new test, but when it was really high, it was around 89%. It has fallen with the new test, okay? Now, so that being said, I said all that to say that you will see I have a little notation on page 5. And that notation says if you are English second language, then you need to challenge yourself to get a higher score, follow the repeat guidelines. So let's say that you did graduate within 30 days, but you were born in another country and you are considered an English second language based on just that. Well, then guess what? You're not going to follow the first time RN guidelines. We're going to need you to follow the guidelines for the repeat tester because we're going to need you to get higher scores to assure you and me that you can kind of translate in a way that will still give you an excellent score on this exam. All right, that's the deal. Now, if you go back to page 3, number 3, and we are here saying that master means that your score is whatever it is you just highlighted. And certainly you should be highlighting number 3 so that you remember it's the most important thing on the page. But you've already highlighted the score that you need. So I'm going to pretend that I'm an RN repeat student. And so I'm going to say, you do the questions in the same subject until you get an 85% in that subject. Does that help a little bit? Now, here's the deal, guys. When you do these quizzes, so it says, for example, do a miniature quiz in the AM, another after lunch, another dinner, one before bed, etc. As many times as you can, obviously. But when you do it and you get that 85, this is another problem I see, even with my beloved students in the class right now, okay? I see my babies, let's say they're mastering GI. Now, you need to know that GI takes the longest to master. It's a bitch. It's hard. It's ridiculous. It's long. It's so ridiculous. But it takes the longest to master. So there you are on Tuesday morning. You wake up. You did your 5 questions in GI. And oh, my God, you got an 85%. Now, before you became multiple orgasmic, you were just like screaming, like, oh my God, I finally got an 85. So now you have to stop. Stop doing all these GI questions because your next trip is to do 85 questions in GI to see if that's really true. So look what I wrote. It says, for example, do a miniature quiz in the AM, another after lunch, dinner, one before bed, etc. Then do a final exam of 85 questions in this subject. If the mastery score is obtained with this final exam, because that's what it's called. You've been doing quizzes all along. Now it's time to do a final exam. If the score is obtained in your final, move on. I have had you in this class right now stay in GI for the next 3 days. Why, Jesus? Why? You just love guts and butts that much? What's happening here? Okay, so stop, because you're not gonna move on. You see, your world expires, okay? So you need to move on as fast as you can. Otherwise, you're not doing this right. Now, then if you look, it says, in this subject, if the mastery score is obtained, move to the next subject and follow the subjects in order on page 24. Let's go to page 24 to point out a couple of things. When we look at page 24, it has all of the subjects that you must do in order. Then if you skip down, it has some specialty topics, and then it has the NGN test plan. So here's our deal, everybody. When you look at how you start this mastery program, and you're on page 24 and you say, okay, I need to do psych and psych meds. And you click on psych meds in your world and you click on mental health, right? Those two subjects at the same time. You are doing your 5 to 25, hopefully smaller bite-sized pieces, but you're doing, 5 to 10 questions in your psych. You may or may not have the psych packet. It depends on if you have all of this stuff on the table. And of course, when you come to boot camp, everything on that table is half off. And so if you do have your psych packet, when you do your psych questions, you are taking notes on your psych packet and you are going and watching a video in psych. Now, I have to remind you, you already will have a pink psych meds packet when you leave here. That psych meds packet is huge. Okay, so you're going to be doing your questions and you're taking notes on both your white packet and your pink packet if you have them both. If you just have the pink, then you are being smart and you're doing a 5-subject notebook like I told y'all to buy, and you're taking your notes in your 5-subject notebook under the headline of psych. Who cares, right? You just need to take notes. So your life is very simple. If you're at the house, it's video, 5 questions, packet. After you reviewed those questions and the rationales and took the notes, you pull up another psych video. Now, so go to your phone right now. Pull up your cell phones right now. Let's do it together, because one of the things I find is that you don't even know how to surf this little page, and you got to know that. Okay, so what you do, you go all the way to your HETV on YouTube, and when you pull it up, you put 4 letters only. Some of you do crazy. Some of you put HETV Nclex, HETV Dr. Shelley. You don't need all that. Just do HETV. That's it. That is it. All capital letters, and do not click on anything underneath it, please. Because we're trying to get you to always go to the same page the same way every time. Don't click on nothing underneath it. Just hit search. It's going to pull me up in a way that should say, and you got to tell me if that's true. Did it pull it up in a way that says view channel? Yes. Everybody got that? Talk to me now, because I want to make sure you did that right. If you didn't do it right, you got to go back because you clicked on something. You were supposed to just put in HETV, and you were supposed to put in search. You were supposed to click search. That's it. Everybody got it? The view channel is important, because if you don't, you won't be able to see the playlist as easily. And so I hit the view channel and I have a page like this, but I've got to slide my titles over a little bit till I see playlist. Does everyone see that? Yes. Okay, now, so you click on playlist, and let's talk about this playlist business, okay? Because some of y'all are just confused as hell. Here we go, y'all. Here's the deal. Playlist is like you just went to the library, okay? You just went to Cuyahoga County Library if you're in Ohio, in Cleveland. That's what you did. Cuyahoga County Library. At the library is a bunch of sections. Agree? the sections on astrology, sections on biology, sections on nonfiction, sections on fiction. Totally stuff. Some stuff in the library is related. Are you with me? Some stuff is just in there for shits, kicks, and giggles. Are you with me? Okay, so in this playlist, your library, there's all kinds of playlists. There's all kinds of libraries. When you click on the playlist, you've captured a book. You in the library, you pulled out a book. Are you still with your girl? When you click on the playlist, you open the chapters of the book. In the chapters of the book are the subjects you're supposed to study. Now, if you're smart, you know good and damn well you ain't reading a whole book. Are you still with me? So you are really only reading the chapters that you need to get to 85. Because if you're not getting to 85 and you keep doing the same shit over and over again, which is the definition of insanity, then you need to go back and watch more videos. There are 1 million books in the library. There are 1 million videos on my playlist. I put my whole nursing school on here, people. Okay? I put the whole thing on it. So let's go look for the book Psych. Let's go look for that big ass textbook called Psych. It's going to take a minute. You just scroll till you see it. Did you find it yet? Yes. Okay, now don't click. How many videos are in Psych? 30. So in other words, you pulled your Psych textbook out. You have 30 chapters in it. And when you're going to click on that Psych with those 30 videos, that means you're going to choose what chapter of the book to read. Are you still with me? Okay. When you click on a playlist, usually the very first video is this. One of the test plans. Are you seeing what I'm doing? So you can see right here that Psych is part of the test plan. So I introduce you to that test plan and what the hell you gotta know for Psych in the very first video. That's what the first video is always going to be. It's going to be the test plan. You need a study guide. Y'all with me? The next video is going to be the actual core topics you need to know. So if you have the white packets, then this and this go together. So you see personality disorders, you will be taking notes in this packet on that. You see depression. Depression's a couple of handouts in here. SSRIs is in your pink packet. Are you still with me? Because your pink packet is going to say psych meds. Remember that, y'all? Okay. And then if you look a little bit further, it says psych bipolar. Well, guess what? There's a bipolar handout in here. Suicide. There's a suicide handout in here. Electroconvulsive therapy. There's not a handout for that because it is a very last resort for depression and suicide. But it flows together. In other words, why did I put bipolar after depression? Well, because depression is also part of bipolar. It flows together. Why did I put electroconvulsive therapy under suicide? Because it's the treatment for it. Okay? It flows. In your packet, OCD, number 4 is another handout. Benzodiazepines treat anxiety. That's why it's under the PTSD, OCD, anxiety. Eating disorders, it's in here. You take notes on these pages. The study guides are right in here. They already typed up half the shit that's on the test on the packet. You just add your notes that aren't in here yet. Okay? Schizophrenia. It's in here. What treats schizophrenia? Antipsychotics. When you look at your antipsychotics, they're such a bitch. I gave you a ton of videos on them. But then you see video number 7 says EPS. What is EPS? The side effects from antipsychotics. Okay? Then you have some things that make your tests that fall under psych, but they're very different from all the other psych videos. There may not be a handout in here with it. That one is sleeping with the enemy, because you better believe your ass gonna have to know on your test how to help domestic violence victims. That's what that is doing, telling you how to help. The whole safety plan, the whole never tell them to leave. That's what you got in that video. You have your alcohol, because that's a handout in here. Your alcohol, your withdrawal, restraints. We know that restraints are done for people psychotic. Okay, so substance use, opioids, alcohol. Then you even have geriatrics, because on this test plan, Alzheimer's falls under psych. So what I did, I said, oh, I better give them some early and mild Alzheimer's symptoms in psych. That's what I did. Pharmacology, all this crap, everything. You may never watch all 30 videos, and that is very appropriate, because you may love psych. I personally hate it, but you may love it and even work in it. All you needed was 5 videos, and boom, you got that 85%. Keep it moving. Keep it moving. Okay? Your second subject after psych is what? What does it say? It's on your packet. I'm asking you. Reno. I want you to go out of this playlist and I want you to find Reno. And it will take a minute. If you're not careful, you're going to be like, oh. Anybody find it?
Yes.
It's at the bottom, isn't it? Okay, now my question is, how many videos are in Reno? 18. Will you need to read this entire textbook, people? No, but we're going to open it anyway and see the chapters, aren't we? So when we open the textbook, we're looking at chronic kidney disease. We're looking at dialysis, which is demonstrated under number 3, ESRD. Basically, that's dialysis because that's end-stage renal. We're looking at the acute renal failure, AKI. We're looking at the labs. We're looking at BPH. Some of you did not look at that, even in my class. Didn't even know I had that. That is for the prostate. You're looking at erectile dysfunction. Then you have reproductive disorders. We have a lot of issues when it comes to the reproductive videos on your, when it comes to reproductive issues on the test. They were, let's just say they were challenged on the test nationally because they didn't have enough for reproductive on there. So now you got to know the birth control. You got to know the STDs. You got to know about fibroids. You got to know about polycystic ovarian syndrome. You got to know about all that shit. Okay, so it's all in here. So if you go a little bit further, there's medications. You'll see the renin-angiotensin aldosterone system, which is RAS. You will see diuretics and loops, loop diuretics, HCTZ. You'll even see organ transplants. Some of the cancer screening has to do with genital urinary. So it's a bunch of shit in here that you may or may not end up watching, but you have your textbook for it. Does that make sense? This is why when you go to nursing school and you figured out, oh, she's got everything I ever needed on my test, you hit the jackpot. I can't tell you how many times I cannot believe all these videos are on my test. Like, all this was my final. Like, thank you. I passed. I passed, not just passed. I passed with an A. Because of course you did. Shit. Everything that could ever be on a fucking final exam is on a damn playlist somewhere in my damn channel. No one else does that. You know it's true. Nobody else in the fucking world does that. All right? So this is all you need to do. Video, questions, take your notes. Video, UWorld, take your notes. When you do it, you pass. Period. Okay, that's it. You got to get a system because that's what the fuck you doing now, starting today. Okay? All right, so you got this. Now, your number 3 on page 3 was gospel. Everything else in here, we will be covering it over the weekend. Now we're gonna start this whole class. So get out your procedures packet and let's talk shop.